A new study has found evidence of a robust cellular memory against COVID-19 that lasts for at least 6 months after infection, reinvigorating the question of whether natural infection with the virus could grant lasting immunity after a study last week showed a rapid decline in protective antibodies in the months after infection. Understanding how the immune system responds to COVID-19 over time is a vital component in controlling the pandemic, underpinning public health measures, treatments, and how vaccines are developed and administered. A lot of early attention has focused on antibodies, proteins produced by the immune system that can lock onto the virus. These are relatively easy to study, but do not give a complete picture of the body's immune system. Cellular studies, such as this one looking at T-cell responses, are much more onerous to conduct, but give a much more complete understanding of how the body is responding to COVID-19 and whether any protection can endure. Just because there is an immune response, does not mean there is immunity from infection. Further studies will be needed to understand the long-term impact of COVID-19 infection. COVID patients show key immunity gauge after 6 months in study. Bloomberg, cellular immunity to SARS-CoV-2 found at 6 months in non-hospitalised individuals study. COVID-19 immunity may wear off after infection. Forbes man, 25, is the first in the US to catch COVID-19 twice, second time worse than the first. Forbes, can you get COVID-19 coronavirus twice? Here is an update on immunity. Forbes, can you get COVID-19 twice? An infectious disease doctor explores the possibility. Forbes, why we can't rely on natural immunity to protect us from COVID-19. Forbes, Fauci attacks herd immunity declaration embraced by White House as total nonsense. Forbes, full coverage and live updates on the coronavirus.